It's a busy slide, but this is showing you the shoulder joint, which is our topic for today. And the red marks are the structures that are involved in the most commonly orthopedic conditions that affects the shoulder joint. So you have your humerus, which is your bone, and that comprises the ball in your ball and socket joint here. The joint is lined by a cartilage, what we call an articular cartilage, that provides nourishment and support and cushion to the joint. And that is the structure that is affected when you have osteoarthritis. And we will discuss that in more detail in the next slides. And then you have the labrum, which is that outer rim of the cartilage lining in your socket. And whenever you degenerate the cartilage or the joint, the labrum can get torn or can get degenerated as well. The labrum can also get injured with trauma or instability in the shoulder. And then we have ligaments that support the shoulder joint, or what is also known as the glenohumeral joint. The glenohumeral joint has this very small socket, so it's very unstable on its own. So it depends a lot on the supporting structures around it to keep it stable. One of those structures are the ligaments, and there are quite a few of them around the shoulder. And whenever these ligaments get stretched or strained or worn out, they can create problems by being lax or sprained or even torn. And then patients are familiar with bursitis, and what that is it's an inflammation of the bursa. A bursa is a sac that contains fluid cushion that acts as basically a lubricant between your bony structures and the superficial structures of your body, like tendons and muscles, and they're located all over our body. And when the surrounding structures like the tendon gets irritated or injured, then that bursa can get inflamed and you can get a bursitis, which causes localized pain in the region where the bursa is inflamed. We also have tendons, which are connective tissue structures that connects your muscle to your bone. And the biceps tendon is shown here, and also the rotator cuff tendons are shown in this diagram. And these tendons can also get injured by getting inflamed, which we call tendinitis, or getting worn out, as we call it, tendinopathy. And we will discuss that in more detail in the next slides. So we're talking about arthritis. There's many different kinds of arthritis, but what we are referring to is a condition that's called osteoarthritis. And that is a chronic condition that involves long-term chronic inflammation of the joint that eventually leads to wearing out or the degeneration of the cartilage, which is the protective lining of your joint. And some of the x-ray findings that we see, this is the picture that you're looking at is an x-ray of your shoulder joint, is that the joint space gets narrowed when those cartilage gets worn out. You have less of the cushion, so you've got joint space narrowing. And then there's also formation of osteophytes or bone spurs, which is the body's way of basically protecting the joint and creating more surface area to withstand the load that is being given to. So osteoarthritis is very common. As we get older, we're going to get osteoarthritis. Majority of the patients more than 60-year-old will have some form of degenerative arthritis in their joints. So it's a very common finding on imaging studies, and it doesn't necessarily mean that you have osteoarthritis on your x-rays or on your MRI that you're going to get symptoms from it. But some patients do, and that's when we start treating them. We talked about tendon disorders in the shoulder. The most common tendon that gets affected is the rotator cuff. Rotator cuff is this group of 4 muscles that keep your joints stable in place, and they're responsible for lifting your arm up and rotating it inside and out in your body. 2 kinds of conditions that involves rotator cuff tendons are it can either get torn or you can have a rotator cuff tear, wherein this fibrous structure that connects the muscles to the bone gets torn, and most commonly this is caused by either trauma or degeneration. Or you can have what we call tendinosis or a tendinopathy, which is not the same as tendinitis. Tendinitis means the tendon is inflamed, but when it's called tendinopathy, it means that it is a primary disorder of that tendon wherein it gets overused and worn out, and that you lose the mechanical properties of the fibers, and that can lead to thickening or tear of the tendon, pain, and inflammation. Just like osteoarthritis, as we get older, these rotator cuff injuries get common. The tissues in our body get worn out, and about half of patients more than 50-year-old can have this condition without having any problems.